Even one drink raises stroke risk, study says. Contradicting previous claims that, this new study links even low levels of alcohol consumption with increased blood pressure that can lead to strokes. The study comes after concluded there is no healthy level of drinking. In the new study, researchers found that 1 to 2 drinks a day increased stroke risk by 10% to 15% and that 4 drinks a day increased the risk of having a stroke by 35%. One drink was there. The researchers, from Peking University, the Chinese Academy of Medical Sciences and the University of Oxford, say they discovered the impact of alcohol on stroke by following 500,000 Chinese people for 10 years. In East Asian populations, the researchers say, there are common genetic variants that greatly reduce alcohol tolerance, because they cause an extremely unpleasant flushing reaction after drinking alcohol. Although these other scientists generally agreed with the study's findings, but some pointed out possible shortcomings. Although David Spiegelhalter, a professor for the public understanding of risk at the University of Cambridge, said the study had given him doubts about his previous theories. Dr. Stephen Burgess, from the University of Cambridge, highlighted limitations to the study, saying that it only examined a Chinese population and focused on spirits not wine. But he conceded its
Raindrop, drop top, smoking, no cooking the hot pot. Fucking on your bitch, yeah, that. Looking up, open the